Hey, what's up everybody? MIllen with Benefit Hackers. Hey, before I start, make sure you check out the link below in the description. There's an ebook on there where I talk about how you can drastically change the coverage and rates of your group medical plan. Take a look at it, it's free. The link is down below. Hey, I want to talk today about mental health, behavioral health. This is something that we have been talking about for quite a while. And there's been a lot of unique changes going on in terms of coverage for mental health, anxiety, stress, depression. And one of the things we're starting to look at, certainly in a medical plan design, you look at the primary care visit copay, you look at the specialist copay. If it's an HSA plan, obviously there are no copays there. You're paying out of pocket at a discounted rate. But what do you do on the behavioral health? One of the things we started looking at is usually in the summary of benefits and coverage, or the summary of benefits plan, which lists out each of the plan items. There's going to be a section there for mental health or things of that nature. And so it's really interesting. If you miss that, a lot of those plans will have a copay, which is really good. And some of the plans even have kind of a virtual component. That is a newer area for a lot of the group medical plans to embed. They've already started embedding some telemedicine for a while, but the behavioral health is a component. So some of them will have restrictions on the number of visits. And that's just something that you should start to think about. If you're not already looking at it, sometimes it's easily overlooked. And so just next time you're looking at your summary coverage, just look through that. And that may be a driving factor for some employees to use the plan or pick one plan versus the other. The other thing I'd strongly recommend you look at is the rise of virtual behavioral health. These are standalone plans that are not connected to any one medical carrier. And these will either have some kind of copay, they're a video call or a phone call with a psychologist, a counselor, even a psychiatrist. And a psychiatrist, remember, can prescribe medications, certain medications. So obviously this is not taking the complete replacement for an in-person visit, but a lot of people are not real comfortable maybe doing that, or sometimes the length, the time it takes to book an appointment can be months. And so that's what I would say. Look at your core medical plan, look at the coverage, make sure you talk about that with your employees, and also consider an outside standalone virtual care package for behavioral health. I'll tell you, a lot of people, the more I talk about just that concept, just being open to talking about it, the more people open up. There's a big stigma sometimes about mental health that means like, you can't handle yourself or you can't control yourself. And that's just not the case. There's lots of stresses going on with people, lots of issues. And so don't be afraid to talk about that with your team or with your employees. So hope that helps. Don't forget, check out that ebook below. And hopefully you're finding these YouTube videos helpful. And I would love to hear your comments. Have a great day.